Let's now go to LI6 or the Veering passage point as we continue our discussion on the Luo-Connecting points. So LI6 is located 3 tune proximal to LI5, which is in the center of the anatomical snuff box, on the line connecting LI5 and LI11 between the abductor pollicis longus and extensor pollicis brevis muscles at the level of the junction of the tendon between the tendon and the muscle. So how to find LI6? First, we have to note that the course of the line connecting LI5 and LI11 depends on the position of the forearm. For location purposes, a mid position of the forearm with flexed elbow is recommended. So to locate LI6, measure 3 tune or 1 hand's breadth from LI5 at the center of the anatomical snuff box on the connecting line. Or we can use the tiger mouth grip method, wherein we spread the thumb and index finger of both hands, crossing them so that the forefinger of one hand comes to rest on the styloid process of the other, but avoiding bending the wrist. Place the middle finger against the forefinger. LI6 is located directly below the tip of the middle finger. Located at the same level, which is 3 tune proximal to the wrist joint space on the dorsal side of the forearm, are triple burner 6 in the depression between the radius and the muscle, and triple burner 7 in the depression between the ulna and the muscle, as well as pericardium 5 on the ventral side of the forearm between the tendons. Okay. We needle LI6 obliquely or transversely or subcutaneously 0.5 to 1 tune. For its actions and indications, LI6 expels wind and clears heat. It regulates and opens the water passages and opens a channel in the Luo vessels. For its special feature, LI6 is the Luo-Connecting point and the major point of the LI channel for regulating the water passages. LI6 is an important point to regulate the lungs' water passages. That is, whenever the lung function of controlling water passages is impaired. This can happen when an exterior pathogenic factor obstructs the circulation of defensive qi in the space between the skin and muscles, giving rise to edema of the face and hands. This can also happen in chronic conditions of lung qi deficiency. So in summary, LI6 is an important point to regulate the lungs' water passages and therefore the movement and transformation of fluids in the upper burner. LI6 is the Luo-Connecting point of the large intestine channel from where the Luo-Connecting channel diverges, hence the name Veering passage. From this point, the Luo-Connecting channel ascends to the jaw and ears, whilst the large intestine primary channel traverses the lower jaw, nose, and face before joining the stomach channel, which connects to the eye. Like many distal points of the large intestine channel, LI6 is effective in clearing wind and heat from all these areas. Example, toothache, in redness and pain of the eyes, in nosebleed, rhinitis, etc. And LI6 is especially applicable for ear disorders such as tinnitus and deafness due to attack of exterior pathogenic wind and heat. The Luo-Connecting channel from LI6 joins with the interiorly-exteriorly coupled lung channel. The guide to the classics of acupuncture states the Luo-Connecting points are located between two channels. If they are punctured, symptoms of the interiorly-exteriorly related channels can be treated. The young large intestine channel may be seen as the outer reflection of its coupled yin lung channel, and its points are frequently used to release the exterior portion of the lung system. When external wind disrupts the function of the lung in regulating the water passages, there may be acute edema, especially of the upper part of the body, accompanied by absence of sweating and difficult urination. Li6 is the primary point of the large intestine channel to open and regulate the water passages and thus treat such symptoms as difficult urination, edema, ascites, and borborygmus with edema. Finally, the Great Compendium of Acupuncture and Moxibustion gives specific indications for excess and deficiency of the Luo-Connecting points. In the case of Li6, they are tooth decay and deafness for excess, cold teeth and obstruction of the diaphragm in deficiency. Thank you for your attention.